The thing that really stands out about Therese is she is one of the program's first doctoral graduates. And so, there's always that first inaugural group, and you're working through a school that's still kind of getting their act together, and we made it work right this time because she was extremely successful in her endeavors. She went right off to Washington with a job at Secretary of Health, and was working on policy matters related to global initiatives. So she was working with CDC folks and HRSA and CMS colleagues, and working on policies that impacted WHO activities and UNICEF and folks like that. So it was exciting stuff. And so right out the gate, she was bringing her epi skills to bear on big picture policy questions. And one of the things that I always think is important about public health is, if you're really going to get out there and make a difference, you want to impact policy, because that's the way it impacts population.
Therese is amazing. She was a terrific student in the Department of Epidemiology, getting her PhD. She was a study coordinator for a federally funded grant that I was the principal investigator on for a number of years, to look at the health effects of uranium processing in Paducah, Kentucky. She managed that very complex study coordination with the University of Kentucky and the University of Cincinnati, did a terrific job. Her background is terrific. She's a nurse, she's an epidemiologist, she has a policy degree, and then a PhD in epidemiology. So she really has all of the tools professionally, and she's got the personal makeup and organizational skills to be successful in virtually any setting she chooses to be in.
It's really all about, at the doctoral level in particular, it's exposing folks to a set of skills that define a process, a research process, the EPI process in this case, and she's now done it on the national scene with international implications, and she's back in the private sector now doing it in a really critical issue where hospital-acquired infections is a major issue facing hospitals these days, safety in hospital settings. And so, that's a skill set that applies there just as well. And so we're excited and proud of what she's doing. We're honored as a school and pleased to have Therese Hughes as the 2015 Alumni of the Year.
I am so honored to receive this award. I love Louisville, I love the university, and I love the School of Public Health and Information Sciences. The school prepared me well for everything that I wanted to do with my career in epidemiology. When I left the university, I went to work in Washington, D.C., went to work for the National Institutes of Health, and then moved over to the Office of Global Health. The experiences that I had here prepared me to work in this arena, worked very closely with CDC, NIH, USAID, Department of State. Although I loved my time in DC, I was ready to come back home. My family is here, so after 5 years, I moved back home, and I want to contribute to the health of the people within my state. And the university has helped me to do that. So I want to especially thank the faculty within the School of Public Health and Information Sciences, to thank the dean, and to especially faculty members, Dr. Susan Muldoon and Dr. David Tolerud, who acted as excellent mentors for me and with my work. So I'm very happy to be home. I thank the university, I thank the dean, I thank the Board of Trustees, the Alumni Association, the faculty within the School of Public Health and Information Sciences, and I hope to contribute to the health of the people within my state. And it's just an exciting time to be here within the university. Thank you.